Hello, and welcome to this video today. We will be talking about a common and serious senior health problem, diabetes. Diabetes is a long-term condition that affects the way your body utilizes blood sugar glucose. It is very common in older adults, and if not managed well, can result in serious complications. In this video, we'll talk about the symptoms of diabetes, how to manage it well, and ways to prevent problems that may occur because of the disease. Section 1. What is diabetes? There are two main forms of diabetes, type 1 and type 2.1. Type 1 diabetes. Type 1 diabetes usually happens in children or young adults. It happens when the immune system of the body attacks the cells in the pancreas that make insulin. People with type 1 diabetes need to take insulin every day to keep their blood sugar level in the normal range. 2. Type 2 diabetes. Most common form of diabetes is type 2, and it most commonly happens to adults after the age of 45. Type 2 happens when the body is not very sensitive to insulin or is not making enough insulin to keep blood sugar levels normal. Type 2 diabetes is more common in older people, especially those who are overweight, are not physically active, or have a family history of the disease. Both types of diabetes cause high blood sugar. If not treated, it causes a wide range of symptoms and problems. Section 2. Risk factors for diabetes in older adults. A lot of factors can increase the likelihood of elderly people developing type 2 diabetes. 1. Age. As people age, they are increasingly likely to develop type 2 diabetes. By age 65, that likelihood is greatly enhanced as the body begins to use insulin ineffectively. 2. Family background. If you have a parent or sibling with diabetes, you're more likely to get it too. Your genes help determine how likely you are to get type 2 diabetes. 3. Obesity. Being overweight or obese is a major risk factor for type 2 diabetes. The fat cells, especially around the belly, can lead to insulin resistance, making it more difficult for the body to regulate blood sugar. 4. Sedentary lifestyle and not exercising sufficiently can lead to overweight and insulin problems. Exercise regularly makes the body more effective at utilizing insulin and reduces the risk of developing diabetes. 5. High blood pressure and high cholesterol. People who have high blood pressure or high cholesterol are more likely to get diabetes. Both of these conditions cause inflammation and make the body's use of insulin more difficult, which raises blood sugar levels. 6. Gestational diabetes. Women who developed gestational diabetes during pregnancy are at a higher risk of developing type 2 diabetes later in life. Section 3. Symptoms of diabetes in older people. These symptoms of diabetes can develop slowly, especially in older people, and can sometimes be confused with normal aging. Some common symptoms to look for include: 1. Increased urination and excessive thirst. One of the most frequent symptoms of diabetes is urinating more often and feeling extremely thirsty. Elevated blood glucose levels cause the kidneys to become more active, causing more frequent urination and dehydration. Stock video concept: an elderly individual urinating frequently or consuming water. 2. Fatigue. Diabetes will leave you feeling extremely tired all the time. If there is excess sugar in the blood, then the body has a hard time utilizing sugar as energy properly, and you tire easily. Stock footage concept: an older person looking tired or resting on a couch. 3. Unexpected weight loss. Weight loss in people with diabetes can happen unintentionally if their blood glucose is not controlled properly. If the body cannot use glucose efficiently, it will utilize muscle and fat to generate energy. Stock footage idea: an older man or woman staring at the scale and appearing concerned about losing weight. 4. Blurred vision. The high blood sugar levels can impact the lenses of the eyes and blur vision. This may be temporary, but can get increasingly bad. Stock footage recommendation: an elderly man or woman rubbing his or her eyes or squinting to focus. 5. Wounds or cuts take time to heal. High blood sugar levels can hurt the body's healing of cuts, bruises, or sores, and cause them to heal slower. Video idea: an elderly person putting bandages over a wound or frowning due to an injury. 6. Numbness or tingling of feet or hands. Neuropathy is damage to nerves caused by high blood sugar. It can lead to numbness, tingling, or pain in the hands and feet. Stock footage concept: an elderly man or woman massaging their hands or feet, wincing. Section 4. Diabetes management in the elderly. Well-controlled diabetes is important to avoid complications and ensure a good quality of life. The following are important strategies to manage diabetes in the elderly. 1. Check your blood sugar regularly. Checking blood sugar on a regular basis is key to diabetes control. Elders must work with their provider to set target blood sugar ranges and keep their levels within those ranges. An elderly individual taking a reading of their blood sugar level with a glucose meter. 2. Take medications as directed if it is prescribed by a physician. Medicines like metformin or insulin can be taken to control blood sugar levels. One should follow the treatment plan and visit a healthcare professional if there are any side effects. Stock footage idea: older adults swallowing pills with water, maybe looking at their medication schedule. 3. A balanced diet. A well-balanced diet is extremely crucial in diabetes control. Note the following: eating whole grains, lean protein, and lots of fruits and vegetables. Cut down on processed food, sweet snacks, and sweet drinks. Being mindful of carbohydrate consumption and portion sizes to prevent blood sugar spikes. Stock footage idea: an elderly man or woman having a healthy meal with vegetables, lean protein, and whole grains. 4. Exercise. Regular physical activity makes the body more sensitive to insulin and lowers blood glucose. Try to get at least 150 minutes of moderate exercise each week, like walking, bicycling, or swimming. Stock footage idea: an older man or woman walking or doing light exercise. 5. Keep a healthy weight. Weight loss, if needed, can really control blood sugar and limit the danger of diabetes-related complications. Pay attention to consuming healthy food and exercising on a routine basis in order to reach and sustain a proper weight. Stock footage idea: an older man or woman exercising, walking, or performing light exercises. Section 5. Prevention of diabetes complications. Size abate may lead to severe health issues, but with proper control, most of these issues can be prevented. Some of the methods of preventing complications are given below. 1. Control blood pressure and cholesterol. Both high cholesterol and high blood pressure can exacerbate diabetes and cause complications like heart disease. Both conditions can be controlled by monitoring the levels on a regular basis and following a physician's instructions for medication. Stock footage proposal: an older man or woman receiving a checkup with a physician to examine blood pressure and cholesterol levels. 2. Manage stress. Chronic stress can harm blood sugar levels. Use stress-reducing methods like relaxation exercises, deep breathing, yoga, or meditation to control stress and improve your overall health. Stock footage idea: an older man or woman doing relaxation exercises or meditating. 3. Protect your feet. Diabetes can damage the nerves in your feet, and it will be difficult to feel injury or infection. You should look after your feet by washing them and examining them for sores. Wear well-fitting shoes and visit a foot care specialist regularly. Stock footage concept: older man or woman examining their feet or discussing with the doctor how to care for their feet. 4. Do regular health checkups. It is extremely crucial to have regular checkups in the case of diabetes and preventing complications. Your physician will monitor your blood sugar, kidney function, eye health, and general well-being during the checkups. Stock footage concept: older man or woman going to their doctor for regular checkups. Conclusion: in short, diabetes can be managed but needs constant care and attention. For older individuals, checking their health every now and then, living a healthy lifestyle, and getting the right treatment are essential in keeping blood sugar levels in check and avoiding complications. With a good diet, regular exercise, stress avoidance, and frequent visits to healthcare professionals, older individuals can stay healthy and active despite having diabetes. Let's keep monitoring our health as we grow older. Take care.